Well, I'm an ear, nose, and throat surgeon, and so I like children and endocrine head and neck surgery. I see patients in the clinic. I do surgery. Like today, I did 6 surgeries in the morning, and some at our surgery center in the back, some at Mobile Infirmary, and then came in saw clinic. And I'm also on call today, which means I'll take anything that comes in through the hospital or phone calls from patients. Ear, nose, and throat. I liked being the expert of an area of the body, and so it was between ENT or OBGYN, just because you do medicine, you do surgery, and you kind of know, you have an exam that maybe other people aren't comfortable with. The anatomy can be complicated, and basically when it came down to choosing between the two, I didn't imagine a practice without little men or handing it over the babies. I was like, well, no, I want to see them too. And so it gives me the opportunity to see everything from a tiny little baby all the way to a 90-plus-year-old and be able to offer them either medical or surgical options for what their problem is. Well, I mean, I like what I do because the anatomy is very complicated and I think beautiful, but I kind of like telling people why or what. I think knowledge is power. And so a lot of times they'll come in and they'll be like, I've tried the nasal sprays and they just don't work. And it's when you explain to them like the mechanism of action and why, how long the little cells in their nose live and why, like one day's worth isn't enough and how it really can take 3 weeks or something, and you explain to them why what they've tried may or may not have worked, not because it's a disease medicine mismatch, but maybe it was a lack of information in how it works. I think that's like fun. And I think that when you kind of put it, medicine is a foreign language of sorts. And so acting as a translator and explaining to them not only what the problem is, but why the anatomy may be different or why there may be a problem with an infection or a bacteria, or, after you've been treated with antibiotics, you have this infection that's not getting better, and it's because it's a yeast, that you've killed off the competition. Like explaining these things and translating it from the medicine lingo to something that they understand so that it empowers them to follow through on their treatment. I think that's the fun part of the practice, is like making them be part of their treatments, because otherwise I can throw something at them and if they don't understand, they're not going to do it. So my philosophy on treating patients, I like to try and, as I said, educate the patient so that when we make a treatment decision, be it that we're going to try medicines or do a surgical approach, if it works or doesn't work, that we all know that we tailored the approach to them and that we used good evidence, a good team approach, and and that we tried to suit it to their needs. And then there's a lot of times where you can offer surgery, and if they want other options, you can kind of talk it through and let them know, like, you may want just medicines, but in your case, at least we've tried this, and this, and it's really, that's the next step. And so for me, it becomes a partnership between us and not just, this is what I think and let's do just this and that's the only option, as much as it is like, let's work together and kind of come up with a solution or figure out, what bothers you the most and how can we make that better. There's something to be said about the fact that there's a group that can survive that amount of time, and there's truly a tradition of excellence. You have pretty much an ENT that's going to fit every personality, and they're, between us all, we've trained at different places, so we bring different brains and different sets of skills to the table, and it's nice that out of 13 of us that there's a collegial atmosphere and that we work together. If I can't solve your problem, then there's a great chance that I can find one of my partners that's got what you need. And so that's a nice thing to know. I've practiced by myself I've practiced as one of 4, and then I've practiced here in this setting. And I have to say the confidence that you have going into it, knowing your partners have your back, knowing that if you get in a situation that you're not sure of where to go next, that you've got people that you can look to for advice or help or something it's a nice thing. Well, I trained at Baylor in Houston, and so I'm very comfortable in head and neck, and I love endocrine, and so thyroids, parathyroids, different surgical diseases of the head and neck. I like that, but my heart's with children, and so there's something fun about it, and it's you're in educating the parents. They get sick fast, but they get better fast, and so that's a lot of fun. I'm a mom, and so it certainly makes me see it with a different perspective, and I get it. Both as a patient, or both as a patient's mother and as the surgeon, and so I kind of understand that there's a certain level of anxiety that goes along with taking a child through surgery that's different than when it's yourself.